Hey guys, you requested House MD.
I get bonus points if I act like I care.
Let's get started. This reminds me of where I grew up in Brooklyn. Or is this a jail?
Why are you late?
You're not gonna like the answer.
I already know the answer.
I miss the boss.
I don't doubt it. No bus stops near Brad's.
Every medical show has to start off with some kind of sexual thing. Medicine is so exciting as it is. Why does there have to be sex? Just calm down, stop having sex for a second.
You should never keep anything from your parents. And I told mine, cut the... What?
Oh, are we having a stroke? Slurred speech? Classic sign of a stroke? Oh. Problems with moving the arms?
C
Call 911.
L H E the. We know that word the.
I'll call the nurse. Oh no. Oh, that's a seizure. She is having a general tonic-clonic seizure.
29-year-old female, first seizure 1 month ago, lost the ability to speak, babbled like a baby, progressive deterioration of mental status.
See that? They all assume that I'm impatient because of this cane.
So put on a white coat like the rest of us.
I don't want them to think I'm a doctor.
You see where the administration might have a problem with that attitude.
People don't want a sick doctor.
Now wearing your white coat, I guess it's not really a big deal because sometimes I go without my white coat and just wear my stethoscope. It's really for infectious purposes only, so that if you get any kind of germs on you, you don't bring it back home to your family, or if obviously some blood splatters on you or some other bodily fluid, I guess.
Brain tumor. She's gonna die. Boring.
That was a little cold.
She's 29. Whatever she's got is highly
The
unlikely.
protein markers for the 3 most prevalent brain cancers came up negative.
Tumor markers for brain cancer. That's not how we diagnose brain tumors. We use imaging. That's the gold standard for brain tumors. Obviously, in addition to biopsy if needed, but tumor markers are not a way to rule out a cancer.
And she's not responding to radiation treatment.
None of which is even close to this positive.
Medically, I'm very confused. There's a patient who had a seizure. They think that she has a tumor. They did some lab work, doesn't show she has a tumor. They're giving her radiation, even though that they don't see a tumor. I cannot be more confused right now, or this totally doesn't make sense medically.
Shouldn't we be speaking to the patient before we start diagnosing?
Is she a doctor?
No, but
Everybody lies.
Dr. Haas doesn't like dealing with patients.
isn't treating patients why we became doctors?
No, treating illnesses is why we became doctors. Treating patients is what makes most doctors miserable.
So you're trying to eliminate the humanity from the practice of medicine?
If we don't talk to them, they can't lie to us.
Excuse me, Dr. House. You can have a good conversation with patients. You don't need to believe every word they say. You can be honest. You can say you don't know, but give a plan of what you're doing about not knowing. So basically how you're getting to the answer.
First year of medical school, if you hear hoofbeats, you think horses, not zebras.
Very common phrase.
First year medical school.
Lab in Trenton could have screwed up the blood test. I assume it's a corollary of people lie that people screw up.
Redraw the blood tests and get her scheduled for that contrast MRI ASAP. Let's find out what kind of zebra we're treating here.
So a contrast MRI basically allows you to see what blood vessels are doing within the brain. The fact that they're going to a lab and questioning if the lab is accurate, we do that occasionally, but that's not the first thing we think about. I guess because this case is more complex.
I was expecting you in my office 20 minutes ago.
Really? Well, that's odd, because I had no intention of being in your office 20 minutes ago.
You think we have nothing to talk about?
No, just can't think of anything I'd be interested in.
I sign your paychecks.
I had tenure.
I can still fire you if you're not doing your job.
I'm here from 9 to 5.
Your billings are practically non-existent.
Rough year.
You ignore requests for consults.
I call back.
You're
Sometimes I miss the aisle.
6 years behind on your obligations
See,
to this clinic.
I was right. This doesn't interest me.
6 years times 3 weeks. You owe me better than 4 months.
It's 5 o'clock. I'm going home.
Doctors don't work 9 to 5s. We have crazy schedules. If someone that's more senior to us, obviously like our boss, like she is in this case, tells you to get something done, you're getting it done. But also because we have a love for the job. We want to treat patients. I don't know why he's being the sarcastic guy, but I will say it's really funny.
I'm angry!
You're risking a patient's life.
I assume those are two separate points.
You showed me disrespect. You embarrassed me. And as long as I work here, you have
Is
no
the yelling
legal...
designed to scare me? Because I'm not sure
I
what it
love
is
her.
I'm supposed to be scared of. More yelling? That's not scary. That you're gonna hurt me, that's scary, but I'm pretty sure I can outrun you.
Okay, that's cool that he's popping pills on the job. Oh, this is in Jersey, Plainsboro. I work in New Jersey.
All right, Rebecca. I know you may feel a little claustrophobic in there, but we need you to remain still.
It's very true that people get claustrophobic in MRIs. You often have to lay there for an extended period of time. The noise is very loud. So there are times that I have to pre-medicate my patients and give them a dose of a benzodiazepine like Xanax, most commonly, that you're probably familiar with. Yeah, it's really loud. It's even louder than this.
I don't feel so good.
It's all right. Just try to relax.
Oh, is she having another seizure?
Rebecca? Rebecca?
Is she choking? Is she having an anaphylactic attack to the contrast?
Get her out of there.
She probably fell asleep. She's exhausted.
She was claustrophobic 30 seconds ago. She's not sleeping. We gotta get her out of there.
Just be another minute.
She's having an allergic reaction to gadolinium. She'll be dead in 2 minutes.
Oh, no. Get her out. EpiPen into the upper thigh. Quick.
Oh, she's ashen.
She's not breathing. Epi point 5.
Come on. I can't ventilate.
Too much edema. Where's the surgical airway pin?
You're gonna need to go in the neck and do a tracheostomy. Did they give her the epi? I didn't see it. Okay, that's way too big of an incision. Okay, not exactly how that goes. If you're allergic to the contrast that they gave for the MRI, it's possible that you can get this anaphylactic attack, which means that your airway starts closing down. Basically, your throat swells up to the point where you can no longer oxygenate. Some people also vomit. Some people get very nauseous. Blood pressure drops. Her airway closed up to the point where she couldn't breathe. But because it's her throat closing up and swelling, if you make an incision in the trachea right here where there's a soft little spot for an opening, you can continue helping the patient breathe. I'm gonna call some inaccuracies here. If a patient turns blue like that, you're hitting a code blue. There's an emergency team coming, nurses, doctors, respiratory therapists. You also gotta get IV set. You gotta figure out why the patient's heart stopped or stopped breathing. There's a lot more that has to happen. You don't just automatically assume it has something to do with the contrast that you gave. And he's still popping pills. What is he popping? Hope those are Advil.
You actually want me to talk to the patient? Get a history?
We need to know if there's some genetic or environmental causes triggering an inflammatory response.
I thought everybody lied.
Truth begins in lies. Think
Okay.
about it.
So why did you tell him to not talk to the patient initially, Dr. House? Truth begins in lies just means that in order to find out the truth, you have the person lie to you, and from there you can then start making a deduction on what part they're lying about. So you need to hear the lie. That's why it definitely makes sense to always talk to patients first, regardless if you believe that they're telling the truth or not.
What are you doing?
Painkillers.
Oh, for you, for your leg.
No, because they're yummy. You want one? Make your back feel better.
No, don't do it. That's how the opioid crisis started, House.
Why are you so afraid of making a mistake?
Because I'm a doctor. Because when we make mistakes, people die.
Yes.
Come on. People used to have more respect for cripples, you know. They didn't really.
I can't see.
Uh-oh.
I can't see.
She's having a seizure again. So turning a patient on their side is the smartest move because you want them to, if they're gonna vomit, they don't aspirate.
Can you arrange these to tell a story?
This is a type of neurological testing to see if the person can follow a series of events.
A couple headaches last month, mild fever. Sometimes I can't sleep and I have trouble concentrating.
Apparently not while we're searching this stuff on the internet.
I was thinking it also might be fibromyalgia.
Excellent diagnosis.
Is there anything for that?
Do you know, I think there just might be. I need 36 Vicodin change for $1.
36 Vicodin and change for $1. Oh, placebo. He's gonna give him sugar pills. Oh, and he's stealing the Vicodin for himself. Again, obviously, doctors don't swap out medications. If we prescribe something to the patient, we send an order to pharmacy and the pharmacists fill the order. And we don't replace it with sugar pills for placebo effect.
You said you didn't find anything.
Everything I found was in
You found ham.
Uh-oh.
So? Where there's ham, there's pork. Where there's pork, there's neurocystic cirrhosis.
That's the condition. Bam, bam, bam. Tapeworm.
See, it fits. It's perfect. It explains everything.
But it proves nothing.
I can prove it by treating.
No, you can't. I was just with her. She doesn't want any more treatments. She doesn't want any more experiments. She wants to go home and die.
That's called the principle of autonomy. Basically, that a patient has the right to refuse treatment at any point as long as they're competent. And by competent, I mean that they're able to understand the consequences of their actions. So if they say they want to go home and you tell them you can possibly die if you go home, they can say that back to you and understand what that means. They're free to go home.
For being an idiot. You have a tapeworm in your brain. It's not pleasant, but if we don't do anything, you'll be dead by the weekend. He's right. We should x-ray her, but we don't x-ray her brain. We x-ray her leg. Worms love thigh muscle. If she's got one in her head, I guarantee you there's one in her leg.
I did not know this. This is beyond my expertise and probably most doctors' expertise.
This here is a worm larva.
Wow.
So if it's in my leg, it's in my brain?
Are you looking for a guarantee? It's there. Probably been there 6 to 10 years.
How does he know that?
Albendazole.
He's giving her a dewormer.
If anyone asks, you have 11 daughters and 5 sons.
Wait, that's 16 students. They said her class has 20. Where are the other 5? Why didn't they show up? Oh wait, 11 and 5. Sorry, the other 4. We're happy you're not dead.
I want a hug and a kiss from every single one of you. Get up here right now.
Don't give the kids the worms. I'm just kidding.
Dr. House, you have a patient. He says he needs a refill.
Got change for $1?
That's funny. Patient got hooked on them Tic Tacs. There we have it. House episode 1, season 1 is in the books. Medical accuracy. It's somewhere in the middle range. These are very rare cases, almost never seen in the United States, like pork tapeworm. Most of our pork is well cooked, so we don't see that. The way that they go about practicing medicine is probably the most unrealistic part of it. House is just a maniac, treating patients without telling them what he's treating them for, breaking into their homes. Crazy, but also crazy entertaining. So I think there's gonna be some very interesting episodes to review from Dr. House. If you know any of these specific episodes that carry a good mystery and a good balance of medical stuff and drama stuff, leave it down below in the comments. If you want me to do a different show, definitely leave it in the comments. The more subscribers we get, again, the better and more content I can continue making. Subscribe, subscribe, subscribe. Stay happy and healthy.
I like to